Yeah, so sarcoma and it's important to put an S at the end of it. This is actually a very large heterogeneous group of diseases, um, but the whole category is rare, even if you put all of them together. But the way I think about sarcomas is you split them up first into two categories. You have bone sarcomas on one side, and you have the soft tissue sarcomas on the other side. Now, bone sarcomas are predominantly seen in the pediatric and adolescent and young adult, or what you'd say as AYA category. The only ones that you really see in the adult category are the chondrosarcomas. But so a lot of adult-focused medical oncologists really don't interact with the bone sarcomas too much. Although sometimes you will get a younger adult patient that shows up with a Ewing or an osteosarcoma, and we'll talk about those a little bit later. But the majority of what is seen in the adult world are the soft tissue sarcomas. And this is a very large group of probably more than 50 different kinds of sarcomas. Now, some are more common than others, but each one of them representing some few percent of the whole sarcoma category, which, by the way, when you look at the spectrum of all human cancers, sarcomas altogether make up about 1% of all human malignancies. And so when you think about any particular patient that walks in the door with, let's say, a leiomyosarcoma or a liposarcoma, you're talking about a fraction of 1% incidence in the population. And so any one of these is going to be a very rare disease. In some subsets, you're talking about really a handful of patients diagnosed in the US in any given year. And so, depending on what the subtype is, it may be a once in a career kind of presentation, right? And you may never see a patient like that again in your life. And so, but you talk about kind of bread and butter sarcoma, if there is such a thing. You're talking about in the soft tissue side, you're talking about predominantly liposarcomas, which are sarcomas that arise from adipose tissues, and leiomyosarcomas, which are sarcomas that arise from smooth muscle. And those are kind of like the two more common ones. And then the other one that actually is probably the most common of them is gastrointestinal stromal tumors, or GISTs, right, which sometimes come through the GI groups, but they are definitely sarcomas still, and should not be confused with gastrointestinal malignancies such as colon cancer or gastric cancer. Okay, they're definitely a sarcoma, and they are probably going to make up the bulk of what an oncologist in the community sees in terms of sarcomas.